Hello, everyone. Welcome to another episode of Hot Mic Cold Virus. My name is Rochelle Beard, and today I'm joined again by my friend Meg Sorg, and we're going to talk about summer safety. So, thank you, Meg, for joining me once again to have another episode of Hot Mic Cold Virus. For those who didn't catch the measles episode, which if you did not, go back and listen to it. Although things have rapidly changed, I feel like since we talked about measles, but the background and the symptoms and all that is still the same. Just the numbers that we talked about will be a little bit different. But for those who don't know who you are, could you just give a brief overview of who you are and why I invited you here?
My name is Meg Sorg, and I am a pediatric nurse practitioner, currently a medical student at the University of Kentucky. We'll be starting year 3 here next week, which is really exciting. I'm also the mom of 4 young children, and so I love all things health. I think that summer safety is incredibly important from both an infectious disease standpoint as well as just a general safety standpoint. So I'm excited to be here talking to you.
Yes. So, because we're talking about summer safety, we know that kids are home and nobody's on a normal schedule. So, we totally understand if anyone pops into the episode, maybe they'll have something fun to add to make the episode a little bit more interesting, maybe. But let's go ahead. We're going to be leading into July. We're in the first week of July and coming up to 4th of July. So people are going to be setting off fireworks, having potlucks. So let's talk a little bit about firework safety. I have worked on a burn unit back in my pediatric nursing days, and I know I've seen some nasty burns. And we were always like holding our breath and anticipating a good amount of ER admissions on 4th of July weekends whenever I worked on the floor. So let's talk a little bit about that. What are the dangers of fireworks? How do we know when someone needs to like go in for a firework injury or a burn injury in general? And what do we look for and how do we prevent them?
Sure. So first of all, 4th of July is one of my favorite holidays. I love fireworks. I love cookouts. I love summer in general. However, fireworks as a mom scare the snot out of me because there are a ton of risks associated with them. Burn injuries, you can even have some smoke inhalation injuries from fireworks. You can have, in addition to the burns, you can have blunt force trauma type injuries that go along with firework explosions. And so those are really a lot of the things that we think about when we're talking about injuries. And they don't have to be great big fireworks either, just the little sparklers that kids love to run around and play with. You can see some pretty significant injuries from those. So you asked about when someone might need to seek emergency room care with fireworks. Really, that's going to be kind of dependent on the severity of the injury and the location of the injury. So anything that has to do really with the eyes or the face, I would say pretty much go ahead and get in there. Any burn that penetrates the skin, we used to classify them as, 2nd, 3rd degree burns, things like that. I would recommend getting in just because burns can lead to nerve damage, they can lead to infections, and they can cause some pretty significant sequelae from the injury itself. I would always recommend getting checked out.
At one point in time, I was certified in, I had a specialty thing in burn care. That was a while ago. I've slept since then. But if I remember correctly, there were rules that applied to if you had a burn on your hand, and that was considered a significant area. I remember, I told my parents this recently. I remember when we were younger, we were up in northern Indiana at my grandparents' farm, and there were some coals. They had like a camping grill, like on the ground or whatever. And there were some coals that were still warm. And my sister was probably like 3. So I would have been around 7. And she went and stuck her hand on those warm coals. And I remember the blisters on her hand and them like I want to say we probably put, I don't know, some kind of homeopathic thing because we were on a farm. And what was it? Was it like the meat tenderizer that you put on burns and like stings and stuff? I feel like that was involved at some point, which is definitely probably not the best idea. But I was telling them, I was like, I'm fairly certain that should have been an ER visit because it literally covered the entirety of her little 3-year-old hand. And my dad was like, she's fine now. And I'm like, yeah, but what I know now, I'm pretty sure that should have been an ER visit.
Mom, can you eat soap?
I would not recommend eating soap.
This is made out of water.
That's hilarious. That's going to stay in the podcast for sure. So we'll go on record. Don't eat soap as part of your summer safety tips. So I'm fairly certain she should have gone to the ER, but the hand is one of those places that you need to pay attention to if you have a burn on your hand, correct?
Yeah. So the concern with the hands really is if there's a burn on the palmar side of the hand where that skin is a little bit different, it can lead to scarring and contractures, which can impair you from being able to open your hand all the way, and can impair your ability really to have that dexterity that's important.
Yeah. So how do we ensure that people are, what are some tips or ways that people can make sure they're using fireworks safely? So like definitely not the whole like put it in reverse, Terry, and running it back when it's already too close to you. But how can we keep people safe while using fireworks? Because they're fun and they're exciting. So
Absolutely.
we want to use them.
Absolutely. So first and foremost, adult supervision whenever you've got kids around fireworks, and ideally adult supervision by someone who has not been drinking all day. Alcohol and fireworks really are not a good combination. And so you want someone who's going to be sober and vigilant in watching kids and in watching the other adults, if we're being completely honest. If you've got fireworks going, you want to make sure that they're being set off at a safe distance from people. Wearing protective clothing like gloves whenever you're setting off the fireworks, or if you can get the kiddos to wear fire resistant gloves whenever they've got sparklers going, that can be helpful. With sparklers, especially, having a bucket of sand that you can have kids put the hot part of the sparkler in whenever they're done running around with them and they've burned out. That can help because, if you've got kids who are running around at twilight and someone throws down a sparkler that has gone out, one, it may still have a little bit of spark to it and it could ignite something, but two, it's still very hot. And if you've got a kid who's running around, they may very well step on that and get a burn on their feet. So things like that. Another lesser thought of concern whenever you've got fireworks is with pets. Dogs especially can be very sensitive to the sounds of fireworks, and if you've got an anxious dog around a bunch of people and especially young children, then there could be a higher risk for bites whenever they're just worked up and nervous. And so being cognizant of how your pets might be reacting to the fireworks as well.
That's a really good point, one that I hadn't even really thought of. Something simple with sparklers too, like just make sure that everyone who's holding them is holding them away from their face. But then not pointed at anyone else's face.
Yep.
So using common sense and keeping that away from your sensitive areas and other people's as well. Keeping good distances away. Setting them off in an appropriate spot. So like, while you might want to set them off in your backyard, maybe your backyard isn't conducive for that. The size isn't big enough or something along those lines. So with firework injuries, I think that kind of just goes right along into talking about general wound care. In the summer, we're doing things we don't normally do throughout the year. We're outside a lot more. Kids are going to fall, adults are going to fall. We're going to scrape knees, maybe break bones. Going to happen. So how do we keep the wounds clean? Again, kind of know when to go seek additional medical care. What are just some ways to manage those injuries?
First and foremost, and this might get me ostracized from some circles, but make sure everybody's up to date on their tetanus vaccines. Tetanus is real. It's out there. It's in the soil. We've got kids and adults. I speak from the pediatric standpoint a lot more, but adults also who are out and exposed to the dirt. And that's where those tetanus spores live. And so please, 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 tetanus shots are so important. So make sure that people are up to date with that. Cleaning wounds is really important. You've got something that has broken the skin barrier, whether it's just a superficial abrasion or whether it's a deeper laceration, keeping those clean as much as possible. And that's not jumping in the pool to clean it off. That's not splashing it with pond water or creek water to clean it off. That's
Oh
actually
gosh.
ideally soap and water. If you're out and you don't have soap and water, having a saline solution to kind of clean those wounds off with is going to be really important to flush the bigger particles out. Making sure that open wounds are kept covered. That if you do have an open wound, you're not going swimming in contaminated water like a lake or a pond. But also, really, I know this is hard, but probably staying out of swimming pools and hot tubs and things like that also will help give you the lowest chance of those wounds getting infected.
I think sometimes, well, a lot of times people don't realize that these like small wounds, little cuts can turn into something significantly worse. Again, referring back to pediatric days, I've seen a few kids that had a small cut and then they ended up having osteomyelitis, which is an infection in their bone, or that could even spread to be sepsis, where you have the infection now spread throughout your entire body. And it could all be triggered just by that main entry point that is small. And it once was just some small cut, but something nasty can get in there and make it travel farther than just that surface cut. So it is very important not to get the pond water in it. Even well chlorinated water, if it's not appropriately treated, can still harbor different bacteria and organisms, and chlorine doesn't kill everything. So yeah, that's very important things to remember. And I want to backtrack to something you said, talking about it being important to get those particles out. This goes into the main principles of like cleaning and disinfection. You always have to clean before you disinfect. And the cleaning aspect is that physical removal of whatever that bacteria or visible particle is. You're actually using that saline or that soap and water to get the item or the particle or the bacteria or just the germ in general out of that wound. And then you can follow up with like some topical antibiotic ointment, or even like, I know some people sometimes clean with alcohol, which could be super painful. But like that can help with the flushing too, because you're still flushing out. But ultimately just using water to flush it out and then following with some type of disinfection can work as well. But you want to make sure to get it out, get that cleaning first before you even attempt to disinfect anything. So I appreciate those points for sure. All right. So we've talked about fireworks, wounds from fireworks and burns. So we're at the potluck setting off fireworks. So let's talk about food safety, because it's hot in the summer. People bring potato salad and fried chicken and hamburgers, and you've got mayonnaise sitting outside in the sun. It's really just the perfect breeding ground for foodborne illnesses. So let's check about that a little bit. How long should we be keeping stuff not at a refrigerated temperature?
Really, when we're talking about foods, you mentioned potato salad, those creamy salads that have mayonnaise in them that everybody loves to bring because they taste really good and they're easy to make. Those are some of the biggest culprits.
The worst.
Honestly, food shouldn't be left at room temperature for more than 2 hours. When we're talking about our hotter temperatures, so those potlucks in July where the temp is hovering at 90 or above, that limit goes down to an hour. And that's because those are the perfect conditions, as you said, for bacteria to just rapidly multiply, and can really set people up to be nice and sick.
Yeah. And I think it's hard for people sometimes to understand like the concept of how foodborne illness is. Like, you do need to have something in there that causes the illness. So the germ does need to be there. And maybe it is at such a low level that it doesn't impact someone or whatnot. But then, like you mentioned, you're just giving it the opportunity to rapidly grow if something did end up in there that it could be infectious, by making that breeding ground just perfect for it to just hang out there and then someone to come and ingest it. So you definitely want to keep it out as little as possible. And if you're gonna go back for seconds later, make sure that everyone put everything away in the fridge. I've been to a potluck or two where half of the family ended up with a stomach bug within the next like 3 days. So definitely take care to put things away and within a timely fashion. I do want to touch on a couple, well, I guess a handful of the most common foodborne illnesses and kind of times to know when to look for symptoms. So you've got norovirus, which everyone has heard of and is super popular because it spreads so easily. Do you remember back when we worked together, when there was a massive
know what you're gonna do.
massive outbreak? And I think I've mentioned this on the podcast before. Our unit was split between two separate floors, and I remember it was within 2 days, there were 22 staff members that had gotten sick with a GI illness that involved vomiting and diarrhea. Nobody got tested, but I think it's safe to assume that it was a norovirus outbreak.
I would definitely agree with that. Oh, I remember that clearly. I remember sitting at the nurse's station, and thankfully, I was one of those people that did not end up with the symptoms. But we sat at this, oh gosh, we sat at the nurse's station in full PPE because we were worried about each other, not the patients that were there. We were worried about contaminating each other.
Yeah, it was terrifying because you were just like counting down the seconds of like when was it going to get me? Luckily, I will say I did not have it badly. I just threw up a couple times but there were some people that it was awful. So norovirus, which the incubation period can be like 12 to 48 hours. So it comes on pretty quickly. We've got salmonella. That one can be as short as 6 hours after ingestion, but typically it can be like 12 to 36 hours, but even up to like 72 hours. Salmonella is a nasty illness to get. It's one that all these typically are self-resolving, but salmonella can be really nasty and like continue on for an extended period of time, much longer than like norovirus that's going to be in and out of your system literally in a couple days, whereas salmonella can go on for a week or even longer and can really take it out of you. You've got E. coli, typically around 3 to 4 days. Listeria, 1 to 4 weeks. So it can actually take a really long time. So it's really difficult to pare down like where you got listeria from. So when you're looking at these like outbreaks, when you get notifications, it's kind of hard to really figure out where that listeria came from, because think about all the different things that you eat in a week. Yep. And trying to really figure that out. But that comes in on your like deli meats, your unpasteurized dairy, but then you hear about it on fruits and all those good things, lettuces.
And to jump in for a little bit with listeria and E. coli, especially listeria, if you have a concern, any kind of inkling that you have listeria or you may have been exposed to listeria and you're pregnant, you need to make sure you contact your obstetrician or healthcare provider about that, because that can have some pretty detrimental effects for the baby. With E. coli, if you have a GI illness and then suddenly you're developing bloody diarrhea and or maybe you're having really dark bloody type urine, you need to make sure that you contact your health provider immediately, because that can lead to something called hemolytic uremic syndrome, that can start as more of a GI illness and move into can lead to kidney failure and organ failure as well. So something significantly more serious than just your run-of-the-mill GI distress, just to kind of put some extra safety awareness about those two.
Yeah, really good points. Another one that is really prevalent in foodborne illnesses. You can just get a Staph aureus infection from foodborne illnesses, and that one's a quick one. So that could be a culprit of your cookouts. Most likely, a lot of times it probably is, because think about people who just carry Staph aureus and how easily it can be spread person to person, or it could be your normal flora. So think about it. It's pretty easy to get some type of staph into your food. So you can have Staph aureus. A lot of times it's on foods that are left out too long. Those creamy foods or processed meats, it can come on like quickly, like sometimes in as early as like 30 minutes, but you're looking at usually like around 6 hours or so. So that could be like you're throwing up when you get home that evening from your potluck, then it could be that. Then there's a few others, just so you're familiar: Clostridium perfringens, Bacillus cereus, and all these are things that foods tend to be the culprits from. So you have to ingest them somehow, whether you ate it or maybe you had some on your hands and you didn't wash your hands and you like picked your teeth or something. You have to like ingest it that way.
And the Bacillus cereus that you mentioned is the one that's associated with reheated rice. I think a lot of people think of rice as being a pretty benign food, and it is often specifically associated with reheated rice. So just for those of you who are big rice eaters, I know my brother-in-law will eat rice on pretty much a daily basis, and I've had to get onto him a few times about not eating rice that has sat out all night for fear of Bacillus cereus.
It's very interesting. And it did, in my notes, it talks about you've got an emetic form, so a vomiting form, and then a diarrheal form. And so the vomiting form will come on earlier, so as early as 1 to 6 hours, and then the diarrheal form will be later, like a 6 to 15 hour mark. It also talks about it could be on pasta or even sauces that are left at room temperature, which are not things that you're going to think about, because if you have like a tomato sauce, you're not necessarily thinking like, doesn't really need refrigeration, not that big of a deal. But so just put it all away. Put it all in the refrigerator, please.
Never going to be wrong to put it in the refrigerator.
Right. All right. So we're outside with this cookout and we're eating. Mosquitoes.
Oh.
They are around all the time.
Yeah.
So,
yeah, mosquitoes are one of those that I really wish Noah would have left off the ark.
Yeah, same. But would it even matter? They could just like fly around and then they would just like land and then feed on the animals and then just fly back off again. So yeah, mosquitoes. Why do we need to worry about them? They're inevitable. You're going to get bit by a mosquito, but when is it a problem versus when it's not a problem?
Because they take your blood.
That is a problem for sure.
Well,
Anna, I'm going to have you on as a guest. You just keep contributing.
As Anna mentioned, mosquitoes do suck your blood, and that's where the real problem comes in. I am a mosquito magnet. I could walk outside and have 10 mosquito bites like that. And the problem is when those mosquitoes happen to be carrying viruses, and those can be regional to different areas. So you've got your malaria carrying mosquitoes, which you associate more with tropical areas. But as climate change happens, again, another buzzword that may get me ostracized from some circles, but
Not this circle.
as we see warmer temperatures, higher amounts of rain, and really kind of a shifting of seasonality in areas in this part of the world, we have started to see the emergence of some of those different types of viruses being in this area. West Nile is a good example of that we've seen in Indiana, Kentucky, Midwestern areas. We haven't seen malaria or dengue or chikungunya, things like that are associated with mosquitoes in this area, but in southern parts of the United States, there have been instances of those diseases being spread by mosquitoes that have come to those areas,
which is relatively new. You would never not too long ago, you would never think of getting dengue or chikungunya in the United States. It would always be prep for somewhere else, but
Absolutely.
they are definitely moving in for
Mhm.
sure.
Absolutely. And we've got people from this area who travel to tropical destinations in the summer, and so there's that exposure. But it creates a public health concern in terms of disease recognition, because if you're not expecting to see those diseases in certain areas, then you're not going to be testing for those. But some of these mosquito-borne illnesses can cause really significant symptoms, and they can be kind of vague symptoms. So oftentimes you're thinking fever, body aches, headache, especially. And the problem is when they can progress to encephalitis, and can cause neurological injuries and neurological issues from the disease.
And I think with those vague symptoms, that's what makes it really hard to kind of catch them early a lot of times, because your first thought, if you start to have a fever or body aches, is that you're not going to be like, oh, this is from a mosquito bite or from a tick bite, which we'll talk about in just a second. So again, it's going to be hard to kind of backtrack and be like, oh, yeah, I was hiking or I was even just outside in my yard.
Mhm.
And I do have a few mosquito bites and having to put together the pieces of that puzzle. So always have that kind of in the back of your mind when you're trying to figure out illness or even talking with your doctor, trying to figure something out, so that that can be included in the differential.
Definitely.
So mention ticks and tick symptoms, tick-borne illness symptoms are going to be very similar. You've got your fever and chills, your fatigue, your muscle aches, headache, joint pain, sometimes even some nausea, GI symptoms. And then when you, again, get into those advanced symptoms or cases, you have those neurological symptoms. One thing that can set some of these tick-borne illnesses apart are going to be the different rashes. So there's rashes that are going to be associated with, I'm sure a lot of people have heard of Lyme's disease. So that's going to be like your bullseye rash. So you've got kind of like the red bite and then like a white part in the middle, and then you've got your bullseye. I did say that right in the steps, I believe. And then you've got like the perimeter that's red. So it looks like a bullseye. And
Yep.
so
Yep.
that's something you're going to be looking for. And with Rocky Mountain spotted fever, you could have, hence the name, a spotted rash on like your wrists, your ankles, and then it progresses onto your trunk. And so those are going to be things that are going to definitely trigger looking into a tick-borne illness, but not everything's going to give a rash. You've got those too, but it's otherwise you're looking at those non-specific symptoms. And like mosquitoes, ticks are everywhere. So while there's different ticks, like with Lyme disease, that's mostly with the black-legged tick or the deer tick. We're not going to go into the scientific names because we don't want to butcher any of those. While those are technically located a lot more times in like the Northeast or the upper Midwest or the Pacific Midwest, it doesn't mean it's free from them being anywhere. They're everywhere. They're just more likely and more concentrated in those areas. But who's to say with climate changes and whatnot that they aren't moving?
Right.
So just so people are familiar with names, not going to go into all these different ones, but you've got ehrlichiosis is another illness, anaplasmosis, tularemia, alpha-gal syndrome. That's one that I know has been hot in the last couple years. That's where you get that red meat allergy. It's going to be coming from the Lone Star tick. It primarily found in the southeast, but it is spreading more north and west. And then there's also something called tick-borne relapsing fever, which is by a soft tick. So some of the other ticks that carry these diseases, you've got the black-legged tick or the deer tick, you've got Lone Star tick, an American dog tick, the Rocky Mountain wood tick, let's see, and then the soft tick. So to me, they're all ticks, and I don't want them on my body.
I agree. I'm not
So
squeamish when it comes to bugs unless it's a tick, and they just turn my stomach a little bit.
yeah.
And with with all of these illnesses, the longer you have the exposure to the tick, so the longer the tick is attached, the higher your risk for developing the infection or for acquiring the infection. And so doing tick checks whenever you've been outside, and honestly, like you don't have to be deep in the woods to get these ticks. You can be playing in the backyard and get them. So checking your head, checking your kid's head, checking in places like under your arms, around your underwear band, in your socks. The ticks like to get in these little places. I one time had, this is really gross, I had a tick attach up here in one of the little crooks of my ear. And so now every time that I come in from outside, I'm running my fingers in my ears. So just being aware of, of checking is going to be really important.
Yeah. Taking a shower within a couple hours of being outside. So then get naked and feel and look over everything. When you're wearing light clothing can make it a little bit easier to find. Obviously, long sleeves, hats, tucking your pants in, your socks, those things to give the ticks less access to your body. Let's be real. Nobody is running around in long sleeves, long pants tucked into their socks in the summer, unless maybe you're like an avid hiker. But
or you're my mother pushing the lawnmower.
Huh?
I said, or you're my mother pushing the lawnmower. I used to give her so much grief for tucking her pants into her socks and wearing long sleeves and wearing a hat for sun protection and bug protection. And now I completely get it. And I will publicly apologize to my mother for making fun of the way she looked.
And another thing you can do is, obviously, you want to use like your EPA registered repellents for both mosquitoes and ticks with DEET. You can treat your clothing and different gear with the permethrin to make it less likely that they'll latch on. And then when you are like hiking or out in the woods or whatnot, or just in outdoors, when you're in like less contained trails or higher grass, obviously that puts you more at risk of coming in contact with the tick. Keep your hair tied back, keep it in a ponytail. I've only found a tick once, and we were doing family pictures. And so when I took a shower, like later on that day, I felt it like loosely in my hair. It hadn't attached. It was just like loose in my hair. But we were just out there for an hour taking family pictures. Like we stood under a tree. So it wasn't anything crazy. So they can definitely attach at any time that you're outside. So make sure that you're doing those tick checks.
You mentioned the bug spray, and I used to get that question a lot when I was in practice full time. Was how young can I use bug spray on my kids? Is DEET safe? I am still a big supporter of the CDC and the work that they have done, and the World Health Organization, and both have said that it is safe for kids to use, for kids as young as 2 months old, to have that DEET exposure and to use that, because the risk associated with tick and mosquito-borne illness is so significant. So using lower concentrations of DEET in your children is going to be really important, so that they don't have the risk of any kind of toxicity from it. Making sure that you're not putting it on hands and faces, especially your little ones who might still be like biting on their hands and things. Don't put it on their hands, but being able to effectively treat your kids with bug spray is going to be one of the best prevention strategies when it comes to your bug-borne illness.
And then along with that, when should people seek medical help if they suspect a vector-borne illness?
Honestly, I'm a proponent for better safe than sorry. So if there's any suspicion of it, it's best to go get checked out. But especially, as you mentioned, if you've got one of those rashes, like a bullseye rash, you've had a tick that you've pulled off, and within the next week or so, there's a rash that pops up around it, go get it checked out. If you've had a bite that has been itchy, suddenly turns painful, that could be an indication that there is a secondary infection, not necessarily from the bug itself, but we all harbor bacteria under our fingernails. And so if you've got a bite that's been itchy and you scratch it and you scratch it and you scratch it and you break that skin, that's a great entry point for those germs to get in and cause infection. So any change in what it looks like or what it feels like for the worse, and maybe it suddenly was improving and suddenly it all of a sudden is painful or is draining, looks like it has gotten more swollen, go get it checked out, make sure there's not an infection there. When you talked about the Rocky Mountain spotted fever, you mentioned the rash that can get on the wrists. You can also see rash with that on the palms and on the soles. A lot of people will recognize that that's the type of rash that you can also see with something as benign as hand, foot, and mouth disease or Coxsackie virus, which causes that. But it can be hard to distinguish the two. And so if you've had a known tick exposure, suddenly you've got a kid who's got a high fever and spots on their hands and feet, don't assume that it's Coxsackie virus. Get them in, get it checked out.
Very good points. And another thing we talked about, the longer the tick is on, then the higher risk of being infected with one of the diseases. So like if you know that you had a tick on you for 36 hours, so you had a couple days and you missed it and you just found it, maybe better to let your provider know even before any symptoms came, just so that you're aware. They may be like, well, we want to like run some tests even ahead of time, or they may be like, let's just wait and see if you have any symptoms of anything. If you can keep the tick after you pulled it off, that's great, because then they can also like identify the type of tick it is and figure out what the illness could be if you did end up getting sick. So I know we all would just love to keep like a tick in a jar, but good practices that if something did happen.
And if you're a higher risk individual, you are immunosuppressed, you're undergoing chemotherapy, and you're in an endemic area for some of these things like Lyme disease or Rocky Mountain spotted fever, your provider may make that decision to go ahead and treat you prophylactically before you've got any symptoms. And so that's an individual decision with respect to what specific circumstances are.
All right, now since we're out in nature with all the bugs, we're gonna go swimming, and whether that be in a pool at the campground or a lake at the campground. So let's talk water safety. Let's talk a little bit just about overall water safety, how to keep from drowning. Let's just cover those bases.
Well, first of all, if you can, get your kids swim lessons. Get them in the water, get them comfortable with the water, but let them know the dangers associated with water and give them a healthy respect for some of the dangers that water can bring. I know that as a parent, that can be a tough balance. Sometimes you don't want to scare them, but you also don't want them to think that they're invincible. One of the most important things that you can do as a parent to prevent drowning with your children is, if you've got a child who is not a strong swimmer, never be out of arm's reach of them, even if they have a flotation device on, because those flotation devices are not 100% fail-proof. So that's a really important point. Another really important point would be to always have someone whose designated job it is to keep an eye on children in the water at all times. And be very intentional about that. So say I'm the one whose job it is to watch the kids at the party. If I have to go in and go to the bathroom, or if I have to go in and refresh my water, not alcoholic drink, if I have to go in and refresh my drink, then I'm going to say to someone, hey, Rochelle, I'm heading in for a second. It's your job now to watch these kiddos. Because if you look at the statistics of child drowning, oftentimes, most often actually, there are lots of adults around. There are lots of strong, competent swimmers around, but the narrative is, I thought so-and-so was watching them. I thought so-and-so was watching them. And that's when those tragedies really hit. And it's so sad and it's so unfortunate. And so being very intentional about who has their eyes on the kids. is going to be really important. I mentioned water as a drink. Most drownings in adults are associated with alcohol use. And so if you're going to be out on the water, if you're going to be especially open water like lakes, ocean, things like that, on a boat, just out paddling around, sobriety saves lives. I'm not a teetotaler by any means. I enjoy a good glass of wine or some fun summer punches also, but making sure that you've got responsible, sober adults who are designated to kind of watch the area and keep everyone safe is going to be really important as well.
Can we talk a little bit about dry drowning? Because I
Yeah.
know you and I saw a kid a time or two when we worked together too with cases like that. What is it? How can you prevent it? How do you identify it? How do you know what to look for?
Sure. So dry drowning is a little bit of a misnomer. There has to be water involved for drowning. What dry drowning is, and that term has kind of gained a lot of traction over the past few years. Basically, what that is a child who's been in the water and doesn't actively drown as we think about drowning, submersion drowning. What happens is these kiddos are the ones who they may be just learning to swim. They may be, at the height where they can touch, but their head's just, those kids who are bobbing along right like this, and they are taking in water, not just into their stomachs, but into their airways. And what happens with these kids is it can lead to flash pulmonary edema, and that's what really dry drowning is referring to, is the airway damage, the lung damage that occurs after exposure to a bunch of water like that. They may not have a significant event where, you think about the submersion injuries where a child goes under, they come out, they're unconscious, everyone is there and watching. Those children, if that happens, they need to be admitted to the hospital for 24-hour observation, because they can develop this pulmonary edema also within those 24 hours. Those are the kids that get identified with it. The kids who don't necessarily get identified with it, unfortunately, are the ones that we talk about who have either significant injury or unfortunately can die from this. They're the kids who you don't see fully go under. They're the kids who just have been bobbing along and taking in all of that water.
What are things that parents or family members should look for to identify nothing happened to this kid, but I need them to be seen? How do they know?
Yeah, so you come home from the pool, you've got a kid who's been there, and they are decreasing in their level of consciousness. I'm not talking about the kid who's tired from being at the pool all day. I'm talking about the kid who's becoming listless, who is hard to arouse because their level of consciousness is changing. Those kiddos need to be seen immediately. You've got a kid who is gasping for breath. Absolutely, that's an airway thing. You get them to the hospital. You've got a child who starts coughing uncontrollably after they've been at the pool all day. Maybe nothing, maybe some allergies, maybe they picked up a respiratory virus, but it could be that they are struggling to breathe because they've got some airway inflammation. Get them to the hospital. Give them that concern. We were at the pool all day. This is a rapid change over the last couple of hours. Get them a chest x-ray. It's not going to damage them to have that minimal exposure to radiation from a chest x-ray. It could absolutely damage them to have that pulmonary edema damage.
This is where people who your children and what's their typical behavior after a day of swimming and what's not. And so use that knowledge of your kids to help you identify, like, oh, this is not normal. I'm going to switch gears a little bit, staying in the water, but going to what I find very scary. It's an amoeba called Naegleria fowleri. And it's a brain-eating amoeba. And I think thank God it's rather rare, but like it's so scary. So for those who aren't familiar, which is probably a lot of people because it's so rare, it's not something that's talked about a ton, but so Naegleria fowleri is an amoeba, which is just like a really small single-celled organism. And this specific amoeba is found in warm, fresh water. So where we're swimming, that's not the ocean, warm, fresh water. So I said it's rare just to give you some data on this. Between 1962 and 2023, there have only been like 164 cases of what's called PAM, which is like the encephalitis disease that Naegleria fowleri can cause. So 164 cases in 60 years, that's rare. You can find this amoeba in any like freshwater body in the United States. So this is your lakes, your rivers, your hot springs, even like warm water discharge from power plants. Can be found in tap water, less likely, but it can be. Water heaters and think like the sediment in the bottom of like your lakes. It likes to hang out in that sediment in different like ponds and rivers, those kind of things. Most cases in the United States are identified in that like southern portion of the United States, especially think like Florida and Texas.
Mhm.
But again, with climate change and water temperatures are rising, and I've done a presentation on this and talked about water temperatures increasing and gave some data about like how much warmer it's gotten in X amount of years. But as the water temperatures increase, the amoeba are being found more northern. And even as far as I think they found some, like there's been an infection in the Great Lakes before. It's like one or two, or I'm not sure exactly the numbers. It's definitely way fewer, but they are being found more north as we continue on. So what this amoeba, Naegleria fowleri, does, so when the water that contains the amoeba enters in through your nose, it then can travel in to the brain tissue and causes this PAM illness that I mentioned. It's primary amoebic meningoencephalitis. So we're going to stick to PAM. And so this can happen. It goes up your nose if you're like swimming, diving. It can even happen. This is like one of those things where they tell you not to use tap water when you do your sinus rinses, because even though it's very, even more rare to be found in tap water, it can still be in tap water. So that's one of the issues with using tap water to do those sinus rinses. So it goes in your nose and goes up into your brain tissue. So what this looks like is in like 1 to up to like 12 days, you can start getting like a severe frontal headache, fever, nausea, and vomiting. And then it can quickly progress to the second stage, which involves stiff neck, seizures, your altered mental status, and then even into a coma. PAM is actually like 97% or more fatal. So in those 164 cases, I believe there were only 4 people who have survived. So it is very important that if you've been out tubing on a lake and someone in your party or yourself gets a severe headache, then like consider it and go get checked out, because it increases the likelihood of survival if you get checked out sooner. You're welcome for scaring you. Just wanted to share the wealth because I get so scared. How do you prevent it? I mean, the only way to prevent it is not getting water in your nose, and you have to assume anytime you're going into a fresh body of water. It can happen in swimming pools, less likely again, but if you are not properly treating it, can happen. Same thing with like splash pads. If the water is not properly treated to where you're killing things appropriately, it can live there. Again, it's less likely, but anytime you're setting foot into a fresh body of water or setting your head into a fresh body of water, there is that risk, albeit slight. But so just always go in with the mindset that if something happens afterwards, you're aware, like, oh, I do need to consider this, even though it is rare. Ways you can decrease the risk, obviously, like holding your nose. We know that doesn't necessarily prevent everything. Don't take your head underwater, but even like splashes that can cause it. Don't swim, but let's be real, and things like that. And don't use, one thing that you can definitely help prevent there and drastically reduce the risk is don't use tap water for your sinus rinses. That's an easy one. But just something else to be aware of. Anything to add about water infections? Gosh, I
Oh,
hate that one so much, but it also like fascinates me too.
yes, yes, it is a core fear. Thankfully, it is rare.
Yes.
One thing that is not super rare are other waterborne diarrheal illnesses, and so that's why you always see at the pools, at public pools, if you've had diarrhea within the last 24 hours, please don't swim. Take kids to the bathroom frequently. Take little ones especially. Make sure that you are checking those swim diapers. If you've got kids who have had bowel movements into their swim diaper, don't let kids squish around in their diapers. Make sure that everybody's washing their hands whenever they have gone to the bathroom. Even if they're jumping back in a chlorinated pool, still need to wash your hands before you get in there. And try your best to not drink any of the pool water, any of the pond or lake water whenever you're swimming. Those are some ways that you can help prevent some of those diarrhea illnesses that are associated with swimming. And again, got to make a plug for vaccines. Polio can be spread through contaminated water as well. So make sure that you and your kids are up to date with your polio vaccines.
Definitely. Swimming in a pool does not negate the need for a shower.
Right.
Much to my husband's dismay. It does not. Let's see. Another fun one that my kids have dealt with is molluscum that can also be transmitted in water. Simple explanation, it's a viral illness that causes some bumps. The bumps are usually flesh colored with a little dimple in them, but it is a virus. Rather hard to get rid of simply because it normally doesn't cause any problems and your body just doesn't care to get rid of it, but it can be transmitted via swimming like in a pool with someone else who has it. Also sharing towels, that's another way that you can get molluscum, as well as any other like skin infectious illnesses. So don't share your towels, even if it's like your cousin and they're over, get them their own towel. You don't want to pass along any of the germs from your skin, because again, you're just setting it up with that wet, moist environment that the germs are like, yes, I love this. This is like an easy place to move around. So again,
wear flip-flops going into like around the pool deck as much as you can. Also wear flip-flops going into public pool showers and bathrooms, please. That's not always water that's sitting on the floor in there. So wear your flip-flops.
Right. Yeah. All right. I think we covered water pretty well. Summer is the time for travel. So quick travel tips. So like anything, just if you're flying, going to hotels, different travel tips there. What have you got?
On planes, they have backed off of the mask regulations, but if you're traveling to a country where measles where they have any measles outbreaks, things like that, you might consider wearing a mask on the plane. You're in an enclosed place with a whole bunch of people, so that's not a bad idea. Make sure you are up to date on vaccines. I can't say that enough. You may consider, if you're going to a country where, if you're traveling out of the country and going to a place that's associated with like traveler's diarrhea, you may consider asking for a prophylactic prescription from your provider. Ask for the education that goes along with that, though, too, because you don't just want to be taking antibiotics willy-nilly. So take that one with a little bit of a grain of salt. Always pack your sunscreen. Always pack your bug spray if you're going to a place where there are mosquito-borne illnesses like malaria or dengue and things like that. Mosquito nets are going to be really important. Check your CDC travel guidelines for different countries. Just traveling domestically, though, even if you're going just, a couple hours away, Make sure that you've got plenty of water in the car. If you have car problems, then you want to make sure that you have the ability to stay hydrated. So those are some generic basic tips that I would recommend.
Backtracking a little bit to the measles, I think it was this week I saw a statement from the CDC saying that everyone should making the statement that everyone needs to be up to date, completely immunized against for measles. Correct me if I'm wrong. I was trying to find the official statement to make sure, but I wasn't locating it quick enough. But they still have not made a blanket statement for younger children, have they, to get their second dose?
Yeah.
Only if you're going to specifically traveling to an endemic area to talk to your provider about getting that early second dose. But other than that, if you are of age, make sure you have your 2 doses before any international travel.
And if you're going, if I have all the confidence in the world in primary healthcare providers, pediatricians, family medicine docs, but they have a lot of information in their heads. And so if they're not sure, then they can, or you can personally contact your most academic health centers will have a travel clinic or will have an infectious disease department that can speak specifically to some of those recommendations that may be a little bit niche for your primary care providers to stay completely up to date on. And so don't ever hesitate to ask for those phone calls or those contact informations.
Right. And I've utilized one of those before, ages ago when I went to the country of Niger in Africa. I went to a travel clinic and they had X amount of vaccines that they recommended. I deduced which ones I felt were the most appropriate, whether I needed a typhoid vaccine or something. I knew I wasn't going to be drinking the water and those kind of things. But yeah, definitely recommend those travel clinics. Along with travel, there's the potential for illness. So just to wrap up, as you're traveling in the summer or returning home from travel, what are some things we need to look out for? You talked about the traveler's diarrhea. So making sure that when you get sick after doing some travel, you're disclosing that to your healthcare provider, because it's going to trigger them to think of some certain illnesses based on where you've been. Also, when you came back from there, how long you were there, who you were around, places you went. And they're not things that you might necessarily be aware of. So make sure that you disclose those things to your provider if you are getting sick on your way back. Also, living in Kentucky, it's allergy season all the time. So how do people identify, am I having summer allergies? That should not even be a thing, but they are. How do I identify that it's allergies and not something else that I need to pay attention to?
That can be tough. And so a couple of general things. Allergies don't tend to cause high fevers. You may get a little bit of just a little bit of mild temperature elevation if you've got bad allergies because of that inflammatory response. But you shouldn't be getting 102, 103, 104 degree fevers from allergies. So that's a big one. We talked about the foodborne illnesses and diarrhea and things like that. Diarrhea and throwing up can actually also be a sign of anaphylaxis. And so if there's any associated trouble breathing with that diarrhea and throwing up, that's a visit to the ER, because that could be an anaphylactic reaction to something. Oftentimes your infectious rashes aren't going to be itchy. And so if you've got high V type, really itchy rashes, usually that's more associated with allergic reaction or allergies versus your infection or infectious type rashes. Respiratory symptoms, both allergies and illnesses can cause asthma exacerbations, wheezing, things like that. So if you're having any kind of trouble breathing, it doesn't matter if it's allergies or if it's infection. If you're having trouble breathing, get checked out because that can turn serious pretty quickly. But generally, your fever is going to be a big indication. If you take an antihistamine medicine and it goes away, I know that's a little bit trial and error, but that's a really good indication that it's allergic related, versus if you take an antihistamine type medication and you're still coughing, hacking, sneezing, there's a good chance that could be a summer cold, because that certainly is still a thing.
I will say I don't hope it doesn't happen again, knock on wood, but like the 2 times I've gotten COVID have been in the middle of the summer. So
Yeah.
you can get sick in the summer for sure.
We're starting to see a little bit of that evening out, but over the last couple of years, because of the way the pandemic caused such isolation and quarantining and really limited the spread of not just COVID, but of other diseases, that summer after 2020, so summer 2021, we saw a lot of RSV in the middle of the summer, a lot of bronchiolitis caused by viruses that aren't RSV in the summer, even saw some flu circulation in the summer. And so from what I have seen, that seems to be settling back into their normal seasonal distributions, but yeah, you can definitely still get those in the summer as well.
Well, I think we need to wrap it up. I think we could talk for a really long time, because I just feel like the summer is a time where like all your routine goes out the window and literally anything goes. So basically you can encounter something you would never encounter 9 months out of the year in the summer, just because you're not doing your normal things. But for the sake of everyone's sanity, we're going to wrap it up. I want to close with just a little question. I didn't prep you for this, but if you were packing a first aid kit for your family and your 4 children, what would you pack in it for the summer, a summer activity?
Water, not just for drinking, but also for flushing things should an injury happen. Band-aids for obvious reason, sunscreen, bug spray, and electrolyte packets. So those like liquid IV hydration kits. You've got sugar, you've got glucose. Those are the 2 things, or excuse me, sugar is glucose. You got sugar and you got salt in there. Those are 2 big things that you lose really rapidly in a state of volume depletion. And so to have an easy way to replenish both of those things, sugar gets a really bad rap in our society, but sugar is essential to making sure your brain is able to get the energy that it needs. So sugar and salt in those solutions, a way to mix them up, a way to get them into the body. So water, those you could go.
Great. I know we didn't really talk a lot about hydration. I think that goes without saying, like stay hydrated in the summer, more so than you think you normally need to. If you're thirsty, then you're already trying to catch up. So make sure that you hydrate. So in closing, as always, if you all need to contact me or have any questions for Meg, you can shoot me an email at rochellebeard@outlook.com. You can also contact me or check out any resources and references that we used in today's episode or any other episode at www.rbipconsulting.com. And then also we have an Instagram page for this podcast. It is at Hot Mic Cold Virus. You can also, if you're watching or listening to this via a podcast platform, you can find video episodes on YouTube at rbeardip. And then, yeah, I think that covers all the social media and internet stuff. Until next time, thanks again, Meg. As a pleasure, always a pleasure. I'm sure I will make you record another one with me soon.
Always
Thanks for listening. All right. Bye, everyone.